Joining us in our strategy session is the senior presidential advisor, David Axelrod. David, thanks very much for coming in.
Hey, Wolf, good to be with you.
Is the president, because we're getting a lot of conflicting information, going to say absolutely that the so-called public health insurance option, a government-run health insurance company that would compete with the private health insurance companies, is he going to say that that's absolutely essential?
Look, Wolf, what he's going to do is deliver a plan that will bring security and stability to people who have insurance, that will help people who don't have insurance get it at a price they can afford and bring down the cost to the whole system. He believes the public choice within that pool that we're going to create for uninsured Americans and small businesses would be helpful in terms of bringing competition and choice. He thinks that'd be good for consumers, and he's going to make the case for that. But he's also going to make the point that this is an ends to a means. It's not the essence of this debate. It's a part of it's one of the tools, and there are other ideas out there to bring competition and choice that are worthy as well,
including what they call the cooperative option, a series of health insurance cooperatives that wouldn't be the public option but would be something in between. Is he going to get into a detail like that and say he likes that idea?
He will acknowledge the fact that there is that idea. There's the idea of putting a trigger on the public option so it goes into effect at some date when it's clear that a market is uncompetitive. There are a number of ideas, but what is very important is that we have the kind of competition and choice that will help consumers. In many states in this country, there's one insurer that dominates the entire market. In Alabama, one insurer dominates 87%. In North Dakota, there's one insurer that dominates.
So why not break down the state barriers and let all of these insurance companies compete nationally without having to simply focus in on a state-by-state basis?
Because we are trying to do this in a way that advances the interests of consumers without creating such disruption that it makes it difficult to
Why would that be disruptive
forward?
If Blue Cross and Blue Shield or United Healthcare or all of these big insurance companies, they don't have to worry about just working in a state, they could just have the opportunity to compete in all 50 states?
But insurance is regulated at this time.
But you could change that. The president could propose a law changing that.
That is not endemic to the kind of reforms that we're proposing, or that
why not? Why not?
We think we're proposing a package that we believe will bring that stability and security to people, will help people get insurance, will lower the cost, and that can pass the Congress. And that has to be the test. We're not into a symbolic expedition here. We're trying to bring real relief to hardworking middle-class people in this country. We believe the plan that we've outlined will do that.
Because I want to move on, but if the president wanted greater competition, he could say, let's change the law and let these health insurance companies compete nationally.
I'm not sure, Wolf, that would end the debate that you asked me about in the first place. And but I think that the idea that he's proposed will promote that. Others have other ideas, but they are not central. What's central here is that we get fundamental insurance reforms that will protect people, put a cap on their out-of-pocket expenses if they have pre-existing conditions, make sure they get insurance if they get sick, make sure they don't get dropped off insurance, and creates a pool where people who can't get insurance today, if you don't have insurance through your employer, it costs you 3 times as much to get insurance today. Most people can't afford it. Most small businesses can't afford to insure their employees. A lot of people won't start a small business because they can't leave their insurance. Our plan would help cope with that.